Hello, gentlemen. If you are over 50, 60, or beyond, and you've noticed that your intimate moments feel different, specifically that you experience the full sensation of pleasure, that peak moment of climax, but without the usual presence of seminal fluid, then this message is extremely important for you. Maybe it happened only once and immediately tied a knot of worry in your stomach. Or maybe it's been a quiet, recurring issue you've kept to yourself, carrying a sense of shame or a silent fear about what it could mean for your health. I'm Dr. Hana Kim, men's sexual health, a urologist with 12 years of experience dedicated to men's vital health at every stage of life. And today, I want to have a serious but deeply supportive conversation with you. First, and most importantly, I want you to know that I understand your concern. The change you're noticing in your body is not a sign that your masculinity has expired or that your intimate life is over. Think of it this way: it isn't a failure. It's a detailed message your body is sending, and that message simply needs to be decoded. Stay with me, because in the next few minutes, we're going to uncover the surprising causes, the critical warning signs, and most importantly, the clear and manageable solutions modern medicine offers to restore your peace of mind, confidence, and overall well-being. Before we explore what happens when the fluid is missing, let's take a quick non-textbook look at how this process normally works. Think of your reproductive system as a perfectly timed orchestra. The testicles produce the sperm. The seminal vesicles contribute the bulk of the rich, nourishing fluid. The prostate adds a protective fluid. This final mixture is gathered and prepared in the urethra. When climax occurs, specific muscles contract in a powerful rhythmic sequence to push that fluid forward and out. It's a rapid event, the result of delicate, synchronized timing between nerves, glands, and muscles. Now, here's a crucial distinction, gentlemen. Climax and ejaculation are not the same thing. Climax is the neurological sensation of intense pleasure, governed by your brain and nervous system. Ejaculation is the physical act of releasing the fluid. Most of your life, they occur seamlessly, as one event, but they are driven by separate mechanisms. Our focus today is on dry ejaculation. This is the technical term for when a man reaches climax, feels that familiar pleasure, but notices little to no fluid is released. Many men describe it to me in my office as an empty orgasm. That gap between expectation and reality fuels worry, and I understand why. You've always expected a physical sign of the moment, but it's vital to understand this. Your ability to feel pleasure can remain fully intact, guided by your brain and nerves. The change is in the mechanical delivery system. This does not mean you've lost your virility. It simply means that part of your body's plumbing has a specific identifiable reason for the change. Quick pause before we count down the main causes. If you're finding this information helpful, please hit that like button so YouTube knows this video matters. Subscribe to join our growing community, and leave a comment below telling me where in the world you're watching from. I love seeing this brotherhood of men supporting each other across continents. Now, let's break down the 3 most common causes of dry ejaculation. Knowing the why is the first step toward feeling back in control. Cause number 1, the gatekeeper is too relaxed, retrograde ejaculation. The most common cause is called retrograde ejaculation. The biology. Picture a small muscular valve, a gatekeeper, at the opening of your bladder. During climax, this valve should clamp shut, making sure the seminal fluid has only one direction to go, forward and out. If that valve is too relaxed, the fluid follows the path of least resistance and flows backward into the bladder instead. You still feel the full pleasure of climax, but because the fluid doesn't exit, the experience feels dry. The practical clue. A common, non-alarming sign is noticing that your urine looks cloudier right after intimacy because the fluid has mixed with it. The practical cause. This often happens after certain prostate or bladder surgeries. These procedures are successful and necessary, but they can affect the delicate nerves that control this gate. It's also a known side effect of some medications used to treat high blood pressure or an enlarged prostate. The medicine relaxes blood vessels, and it can also relax that tiny muscle. I remember a patient, a very proud man, who was devastated after a successful prostate surgery. When he understood that it was purely a mechanical change, like a traffic light stuck on green, and that his desire and ability to feel pleasure were completely unaffected, he felt enormous relief. Cause number 2, the plumbing is blocked. Duct obstruction. The second major cause is an obstruction in the ducts that carry the seminal fluid. The biology. The seminal vesicles and other glands are producing fluid normally, but think of the small ducts as delivery pipes. If these pipes become blocked, the delivery pathway is interrupted. Even though production remains normal, the volume drops dramatically or disappears altogether. The practical cause. These blockages can develop from scar tissue left behind after past infections, such as severe untreated prostatitis. In rarer cases, tiny calcifications like microscopic stones can form and obstruct the passage. The practical signs. Symptoms can be subtle, but some men notice a new mild pelvic discomfort during climax, or they observe that their fluid has slowly become thicker and less abundant over time. The good news is that many of these obstructions can be treated. In many cases, medication is enough to reduce inflammation, and when necessary, minimally invasive procedures can restore normal flow. 3. Low fuel hormonal factors. The third major area to examine is hormonal balance, particularly low testosterone. The biology. Testosterone is the primary fuel for the male reproductive system. It doesn't just control desire and sperm production, it is essential for the healthy function of the prostate and seminal vesicles, which produce most of the fluid. When testosterone drops significantly, the entire system begins to slow down. The emotional impact. At first, you may notice a reduced fluid volume. Over time, this deficiency can appear as lower libido, softer erections, and a less intense climax. More broadly, many men experience fatigue, mood shifts, and loss of muscle mass. The practical solution. This condition is often called hypogonadism, a treatable hormonal deficiency. A simple blood test can confirm it, and carefully managed hormone replacement therapy can often restore fluid production, energy, desire, and overall quality of life. It's a mistake to dismiss this as just aging. While most causes are manageable, as your doctor, I must also highlight the critical exceptions. Dry ejaculation can sometimes be a warning sign of a more serious condition, which is why paying attention to other symptoms is essential. When should you seek help immediately? If dry ejaculation appears suddenly and without explanation, especially if it's paired with pain, blood in urine or fluid, fever, or numbness in the genital area, do not wait. These signals require urgent urological evaluation. Certain neurological conditions like Parkinson's, long-standing uncontrolled diabetes, and in rare cases, specific urological cancers can interfere with nerve signaling or the plumbing itself. The emotional impact is real. Beyond the physical changes, the emotional weight is significant. Many men associate fluid with performance and virility. When it disappears, feelings of inadequacy, anxiety, and frustration often follow. Some men begin avoiding intimacy out of fear of judgment or feeling incomplete. The emotional reassurance. The most powerful step toward breaking this cycle is education and open communication. Recognizing that this is a physiological change, not a personal failure, lifts an enormous burden. Your ability to feel pleasure, maintain erections, and enjoy connection does not depend solely on fluid. your intimate life can and should remain fulfilling. Your clear action plan. To conclude, here is a supportive and practical roadmap for taking back control. 1. Don't ignore it. Investigate it. A sudden or gradual change in ejaculation deserves a urologist's evaluation. A medical history, physical exam, and basic blood or urine tests are often all that's needed for diagnosis. 2. Manage underlying conditions. Keep diabetes, blood pressure, and cholesterol under control. These directly affect the nerves and blood vessels that regulate the entire system. 3. Break the silence. Talk openly with your partner and your doctor. Speaking about it is freeing and opens the door to real solutions. Medication adjustments or targeted treatments can restore confidence and peace of mind. Final message, gentlemen. The absence of fluid is not the end of your intimate life, nor is it a verdict on your masculinity. It is a message from your body that deserves attention and understanding. Whether the cause is mechanical, obstructive, or hormonal, identifying it is the first step toward peace of mind. I've watched countless men reclaim their confidence, vitality, and joy after receiving a clear diagnosis and plan of action. Your vitality is not measured in milliliters. It is measured in your health, your well-being, and your ability to live fully and connect deeply. Don't let shame or doubt stop you from seeking answers. Acting early can completely change your experience and restore the security and intimacy you deserve. If this message helped you, share it with a friend, father, or brother. Leave a like so more men can find this information and subscribe so you don't